Statins are important drugs that lower plasma cholesterol, and their major role is protecting patients against the effects of heart disease and preventing heart attacks and strokes. We wanted to model blood flow because the endothelial cells that line all of our blood vessels are constantly exposed to the flow of blood, and this alters their behavior, how they can respond both to normal and natural signals, but also to the drugs that we all take at one time or another. So we have modeled blood flow in the lab to see how endothelial cells respond to statins with different patterns of blood flow, representing that is within our normal arterial system.
So we measured the system by using two different kind of system in vitro in laboratory conditions. We used this cytidine system to measure this straight part of aorta where the blood flow is continuous. And we also measured this disturbed flow system which is along these arches or branches of the aorta by measuring this disturbed flow, oscillatory flow in this aorta. And we used the cytidine system and the disturbed flow and found how this different kind of blood flow affects the efficacy and sensitivity of the drugs in different part of endothelial cells.
So what we found was that the straight part of our blood vessels respond very well to statins, and we see a large increase in the expression of the protective enzyme hemooxygenase 1. However, the areas of our aorta that is most prone to furring up and the causes of heart attacks and strokes around the branch points responded much less well, and the level of the protective enzyme was less than that we would really like to see. What does this mean? Well, the first thing is to say that it does not mean that statins are ineffective. They're extremely effective and protect thousands of patients against heart disease and stroke. But the relevance of our work is that the statins are less good than we would like at inducing the protective enzyme at the most at-risk sites. So what this means for future research is that if we can understand ways to switch on the protective mechanisms more effectively at the high-risk sites, we may be able to protect more patients. So this might be a different form of statin, or it might be a new drug to work with the statin to optimize the protection of our blood vessels. One important future direction is a collaborative study we're doing with the bioengineering department at South Kensington, led by Professor Ross Ethier. This has been funded as part of the British Heart Foundation Research Excellence Award, and will use their expertise in modelling blood flow within the aorta very accurately, so we can model the flow at different parts of the aorta, and we can then link that with our studies to the precise biology, and in this way hopefully identify new targets for future drug treatments.